There is a moment many people over the age of 60 know very well, even if they have never talked about it out loud. It happens when you first stand up and begin to walk. For the first few steps, something feels slightly off. Not exactly pain, not exactly dizziness, but a feeling of unsteadiness, like your body needs a few seconds to remember how to move safely. You may slow down, reach for a chair, a wall, or a table, just until you feel stable again. After a short time, your walking becomes normal and the strange feeling disappears. Because it goes away so quickly, most people ignore it. They tell themselves it is just part of getting older. But what if that unsteady feeling is not just age? What if it is actually your body trying to send you a message? Welcome to Specialist Doctor. I'm Dr. Thais Aliabadi, and today we are going to talk about why you feel unsteady when you first start walking after sitting or lying down, especially after the age of 60. This is something many people experience, but very few people understand. Many patients tell me, once I start walking, I'm fine. It's just those first few steps that feel strange. And that detail is very important because it tells us a lot about what is really happening inside the body. Walking is something we usually take for granted because it feels automatic. But walking is actually one of the most complex activities your body performs. It requires your brain, your inner ear, your eyes, your nerves, your muscles, your joints, and your heart to all work together at the same time. If even one part of this system is slightly out of sync, your brain senses instability, and that feeling shows up as unsteadiness. When you are sitting or lying down, your body is in a stable position. Your blood pressure is steady, your muscles are relaxed, and your balance system is not working very hard. But the moment you stand up and begin to walk, your body has to make several rapid adjustments. Your blood pressure has to change quickly to push blood up to your brain. Your balance system in the inner ear has to reorient your position. Your eyes have to help guide your movement. Your leg muscles have to activate and support your weight. Your brain has to coordinate all of this in real time. When you are younger, these adjustments happen almost instantly. You stand up, you walk, and you don't even think about it. But after 60, these systems can become slightly slower to respond. Not broken, not failing, just slower. And in those few seconds while your body is adjusting, you may feel unsteady. This is why those first few steps matter so much. They are the moment when your body is switching from rest mode to movement mode. And if that transition is not smooth, your brain senses that you are not completely stable yet, and it sends a warning signal. That warning signal is the feeling of unsteadiness. And the important thing to understand is this. That feeling is not just in your legs, it is in your brain, your blood pressure, your balance system, and your nerves all trying to work together at the same time. When you first stand up and begin to walk, your body has to perform a very complex adjustment in a very short amount of time. The most important thing that has to happen in those first few seconds is that your brain must continue receiving enough blood and oxygen while your body changes position. When you are sitting or lying down, gravity is not pulling blood away from your brain as strongly. Your heart does not have to work very hard to keep blood flowing upward, but the moment you stand, gravity suddenly pulls blood toward your legs and lower body. This happens instantly, and your body must react instantly to prevent a drop in blood flow to the brain. To handle this, your body uses a very smart system involving pressure sensors in your blood vessels, especially in your neck and chest. These sensors detect even small changes in blood pressure. When you stand up, they sense that pressure is dropping in the upper part of your body, and they quickly send a signal to your brain. Your brain then tells your heart to beat a little faster and tells your blood vessels to tighten slightly so that blood can be pushed back up toward your brain. When this system works perfectly, you never notice it. But after the age of 60, this response can become a little slower. The sensors are still working, the heart is still working, the blood vessels are still working, but the timing is not as perfect as it used to be. So for a few seconds, your brain may not be getting quite as much blood as it wants. Not enough to make you faint, but enough to make you feel slightly lightheaded, off balance, or unsteady. This is one of the most common reasons people feel unsteady during the first few steps. It is not that your legs are weak, it is that your brain is waiting for stable blood flow before it feels safe and balanced. Your brain is very protective. If it senses that something is slightly off, it will make you slow down. That feeling of unsteadiness is actually your brain telling you, wait a moment, let me stabilize things before we move too fast. There is another system involved as well, and that is the balance system in your inner ear. Inside your ear, there are tiny fluid-filled structures that detect movement and position. They tell your brain whether you are standing, turning, bending, or moving forward. When you first stand up, the fluid in these structures shifts, and your brain has to interpret that information and combine it with what your eyes are seeing and what your feet are feeling on the ground. After 60, the balance system can become slightly less sensitive. Vision may not be as sharp, especially in low light. Nerve endings in the feet may not send signals as clearly as they used to. This is very common, especially in people who have diabetes, circulation issues, or simply age-related nerve sensitivity changes. So now your brain is trying to make decisions about balance with slightly less information and slightly slower signals. Imagine trying to stand on a moving bus while wearing blurry glasses and earplugs. You could still stand, but it would take more concentration, and you would probably move more slowly and carefully. That is similar to what the brain experiences when balance signals are weaker or slower. So during those first steps, your brain is collecting information from your eyes, your inner ear, your muscles, and your feet, and it is trying to make sure everything is stable before it allows you to walk normally. Muscles also play a role, but not in the way most people think. It is not just about strength, it is about timing. When you stand up, certain muscles in your legs and hips must activate immediately to support your body weight and keep you balanced. If these muscles are slightly slower to activate, even if they are strong, you may feel wobbly for a moment. This is why some people say, once I get going, I'm fine. Because after a few steps, the muscles are fully engaged, blood pressure is stable, and the balance system has adjusted. Joint stiffness can also contribute to this feeling. After sitting or lying down, joints, especially in the ankles, knees, and hips, may be stiff. These joints are extremely important for balance. Your ankles, in particular, make tiny adjustments every second to keep you upright. If the ankles are stiff, those tiny adjustments are slower, and balance feels less stable at the beginning of walking. So when you put all of this together, you begin to see the full picture. In those first few seconds after standing, your blood pressure is adjusting, your brain is stabilizing blood flow, your inner ear is recalibrating, your eyes are helping guide movement, your nerves are sending signals from your feet, your muscles are activating, and your joints are loosening. That is a lot of activity happening in a very short time. If any part of that process is slightly slower, slightly weaker, or slightly stiff, you will feel it as unsteadiness, not because your body is failing, but because your body is adjusting. The important thing to understand is that this moment, those first few steps, is when most falls happen. Not after you have been walking for a while, but right at the beginning. That is why this topic is so important. Because if you can make that transition from sitting to walking smoother and safer, you can greatly reduce your risk of falling. In the next part, we are going to talk about what makes this problem worse, what health conditions and daily habits can increase unsteadiness, and what simple things you can start doing to make those first steps feel much more stable and much more confident. When we look at why this feeling of unsteadiness becomes more noticeable after the age of 60, we have to look not only at the balance system and blood pressure, but also at everyday habits, health conditions, and small changes in the body that build up over time. Most people think balance problems happen suddenly, but in reality, they usually develop slowly. The body adapts, and because the changes are gradual, people often do not realize their balance is getting worse until they have a close call or a fall. One of the most common contributors to unsteadiness is reduced physical activity. When you move less, the muscles that are responsible for stabilizing your body become less responsive. Again, this is not just about strength, it is about coordination and reaction time. Balance depends heavily on small stabilizing muscles in the ankles, legs, and hips. These muscles are constantly making tiny adjustments to keep you upright. If you sit for long periods every day, these stabilizing muscles become slower to respond. Then, when you stand up and start walking, your body needs a few seconds to wake up those muscles, and during that time, you feel unsteady. Another major factor is nerve sensitivity in the feet. The bottom of your feet contains thousands of nerve endings that send information to your brain about the ground you are standing on. They tell your brain whether the surface is hard, soft, tilted, or uneven. This information helps your brain keep your body balanced. But after 60, and especially in people with diabetes or circulation problems, these nerves may become less sensitive. When that happens, it is like your brain is getting less information from the ground. Imagine trying to stand and walk while wearing very thick gloves on your feet. You could still walk, but you would feel less stable because you cannot feel the ground as well. Vision also plays a bigger role in balance than most people realize. Your eyes are constantly telling your brain where your body is in relation to the room around you. When you first stand up, your brain uses your vision to help orient your body. If your vision is blurry, if the lighting is dim, or if your eyes take a moment to adjust, your brain has less information to work with, and you may feel unsteady. This is why many people feel more unsteady at night when they get up to go to the bathroom. It is not just because they are sleepy, it is because the room is dark and the brain cannot use vision as effectively to maintain balance. Medications are another very important and often overlooked cause of unsteadiness. Many common medications taken after 60 can affect balance, blood pressure, or reaction time. Blood pressure medications, especially if they lower blood pressure too much when you stand up, can cause lightheadedness. Sleep medications can make you feel groggy and slow your reaction time. Some anxiety medications and pain medications can also affect the nervous system and balance. This does not mean these medications are bad, but it does mean that if someone is feeling unsteady, their medications should be reviewed by a doctor to make sure they are not contributing to the problem. Dehydration is another hidden cause. Many older adults do not drink enough water, often because they do not feel thirsty as often as they used to, or because they are trying to avoid going to the bathroom frequently. But when you are dehydrated, your blood volume is lower, and this makes it harder for your body to maintain stable blood pressure when you stand up. This can lead to that unsteady feeling in the first few steps. Sometimes, something as simple as drinking more water during the day can noticeably improve stability. Joint stiffness, especially in the ankles and hips, also plays a major role. Your ankles are like the foundation of your balance system. When you start to lose balance, your ankles make tiny movements to correct your position. If your ankles are stiff, those corrections are slower and less effective. The hips are also very important because they help control side-to-side balance. If the hip muscles are weak or stiff, you are more likely to feel like you are swaying when you first start walking. Fear also plays a role, and this is something many people do not talk about. If you have felt unsteady before, your brain remembers that feeling. The next time you stand up, your brain becomes cautious. You may move more slowly, your muscles may tense up, and your walking pattern may change. Ironically, this stiffness and hesitation can actually make balance worse. The body balances best when movements are smooth and confident. When you are tense and afraid of falling, your movements become stiff and balance becomes more difficult. So now we can see that unsteadiness in those first few steps is usually not caused by just one thing. It is usually a combination of factors: blood pressure adjustment, balance system changes, nerve sensitivity in the feet, vision, muscle reaction time, joint stiffness, hydration, medications, and even confidence. Each one may be a small issue on its own, but together, they can create that feeling of instability when you first start walking. The good news is that because this problem usually has many small causes, there are also many small things that can help improve it. And when you improve several small things at the same time, the overall improvement in balance can be very noticeable. In the final part, we will talk about what you can actually do in your daily life to make those first steps safer, more stable, and more confident, so that you are not afraid when you stand up and start walking. As we finish this discussion, the most important thing to understand is that feeling unsteady when you first start walking after the age of 60 is very common. But it is not something you should simply accept without understanding. Your body is not trying to make you fall. Your body is trying to protect you. That feeling of unsteadiness is a signal. It is your brain saying, "Give me a moment to adjust. Let me make sure everything is stable before we move." The problem is that in today's world, most people stand up and start walking immediately. They stand up quickly, take a step quickly, turn quickly, and their body does not have enough time to adjust blood pressure, activate muscles, and stabilize balance. Those first few seconds are when your body needs time the most, and that is when most people rush the most. One of the simplest and most effective things you can do is something very small. When you stand up, do not start walking immediately. Stand up and then pause for a few seconds. Let your body adjust. Let your blood pressure stabilize. Let your balance system orient itself. Then start walking slowly for the first few steps. Those few seconds can greatly reduce your risk of falling. Another very important habit is to make sure your environment is safe, especially at night. Many falls happen when people wake up and try to walk in the dark. Make sure there is a small light. Make sure there are no loose rugs, no wires, no clutter in the walking path. Your home should be a place where you can walk safely without worrying about tripping. Movement is also extremely important. The less you move, the more unsteady you will feel. The more you move, the more your brain and body practice balance. Walking, gentle leg exercises, and simple balance exercises can make a big difference over time. Balance is like a skill. If you practice it, it improves. If you do not use it, it gets worse. Footwear also matters more than people think. Shoes that are too loose, too soft, or without proper support can make balance worse. Shoes with a firm sole and good grip help your brain get better information from the ground and help you stay stable. It is also very important to talk to a doctor if you feel unsteady often. Your blood pressure may need to be checked when sitting and when standing. Your medications may need to be reviewed. Your vision and hearing may need to be checked. Sometimes a small adjustment in medication, a new pair of glasses, or physical therapy for balance can make a very big difference. Most importantly, do not ignore the feeling and do not be embarrassed by it. Many people do not talk about balance problems because they think it means they are getting old or weak. But balance is not about weakness. Balance is about systems working together, and many of those systems can be improved. Confidence is also very important. When people are afraid of falling, they often walk less, but walking less makes balance worse, which increases the risk of falling even more. So it becomes a cycle. The goal is to break that cycle by making walking safer and more comfortable, not by avoiding movement. Remember this: the first few steps are the most important steps. That is when your body is adjusting. That is when your balance system is waking up. And that is when you need to give yourself a little time and a little patience. If you take nothing else from this, remember this simple rule: stand up slowly, pause, then start walking slowly. Give your body those few seconds to adjust. Those few seconds can prevent a fall, and preventing a fall can protect your independence, your confidence, and your health. This is Dr. Thais Aliabadi for Specialist Doctor, and the goal is not just to live longer, but to live safely, confidently, and independently. And sometimes, the smallest habits make the biggest difference.